to school again. From the start of the outbreak, we watched in horror as deaths mounted and as the threat mushroomed from country to country. By the end of 2020, SARS-CoV-2 had spread to over 190 countries. It had even reached Antarctica. Around 80 million cases had been identified. More than 1.7 million deaths had occurred. These numbers are of a magnitude that is difficult to comprehend. In 2020, months felt like years. But one month stands out. In March 2020, the World Health Organization, WHO, declared that severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, the novel coronavirus that causes coronavirus disease 2019, COVID-19, had started a pandemic. During this chaos, I first approached the task of writing about the pandemic in the only way I knew how, by surveying the science of coronaviruses. This book is a snapshot of that knowledge. The picture may not be fully in focus, but it is no longer as blurry as it was on the 31st of December 2019, when the China office of the WHO was alerted of pneumonia of unknown cause that turned out to be caused by SARS-CoV-2. Since then, we've been living in extraordinary times, when deciding to do simple things like going to a grocery store has become an exercise in real-time risk assessment. And like everyone else, there is the mental weight of decisions to be made. To take a flight, to visit an aging parent, or to send a child to school. Let me take you back to the early days of the pandemic. The defining symptoms of COVID-19 were initially thought to be mainly fever, cough, and shortness of breath. At that time, public health officials had not advocated the universal wearing of face masks in public. Transmission of SARS-CoV-2 had been reported to be less efficient than for influenza. The spread of the disease through aerosols was unknown. The effect of events where many people got infected at once had not been documented. And the disease was thought to be spread by those who were sick only after they got sick. India had not yet entered the largest lockdown in its history. In the United States, the ramifications of the initial failure to develop a diagnostic test that worked had not fully dawned on everyone. President Donald Trump and his family and colleagues had not been infected and had not recovered. The United Kingdom had not been gripped in fear over a new variant of the coronavirus. In just 1 week in March 2020, global financial markets nosedived into bear territory, signaling a downturn. Economists revised their gross domestic product (GDP) estimates downward. Cities and countries across the world closed borders to their own citizens and to citizens of other nations. Gatherings were banned. The world stopped shaking hands. We worried about touching door handles and buttons in lifts. We stopped touching our own faces. World leaders recommended proper hand-washing techniques. The Prime Minister of the United Kingdom, Boris Johnson, who would later get infected and would recover, suggested singing Happy Birthday twice to ensure that the ritual had been done for 20 seconds. Shoppers fought over the last few rolls of toilet paper in supermarkets in Western countries, and Indians observed this with a bit of curious bemusement. Meanwhile, India, the world's main supplier of generic drugs, restricted exports to store them up for its own citizens. Hundreds of millions of children began missing school. We were entering a period of uncertainty in March, but the general sense in the street was that this would be over quickly. From March through July, we learned more about COVID-19 and how it is unlike any other disease that we have faced before. We learned that symptoms also include loss of smell and taste, vomiting, diarrhea, nausea, and headaches. We know much more about the trajectory of the disease and the spectrum of outcomes. We know that silent infections in those who never developed any symptoms of sickness and in those who will get sick.